Yeah, absolutely. So oftentimes, like you said, women kind of just assume it's meant to be painful, and they've never really asked or questioned it. And the numbers are pretty high in terms of how many women feel pain with sex and consider it sort of baseline and normal and expected, but that's not true. And once they actually usually what happens is when they start having more worsening painful sort of sex, they seek out treatment, or if there's something else that happens, like for example like herpes, that can happen in the genital distribution as well. So anytime something that kind of exacerbates their pain and they come to seek pain relief or an evaluation, that's when they realize, after having consultations either with their OBGYN or urologist or a physiatrist or us as pain physicians, that they realize that sex really shouldn't be painful. And that's when they understand that there are other options available, whether that's pelvic floor physical therapy for pelvic floor muscle dysfunction, whether there are medications, lubricants, sex therapy, even cognitive behavioral therapy, and sometimes even injections. So oftentimes our patients will have a diagnosis, which is kind of like a very broad diagnosis called vulvodynia, right? So essentially pain in the vulva sort of distribution. But even something like that, where, you know, it can cause dyspareunia, which is painful sex. Once they kind of have a diagnosis associated with it, and then they start seeking out treatment, they realize after having these conversations that it wasn't meant to be painful in the first place. And then they get plugged into the right providers. And now we're working on this multidisciplinary sort of approach to now kind of overcome the hurdles and take those steps appropriately to create a new sort of normal, a new baseline. And a lot of this also includes conversation, not just with the patient, but also the partner. You know, that's why we recommend sex therapy, cognitive behavioral therapy, psychotherapy as well in conjunction.